What if your body warned you a full month before a heart attack and you mistook it for the flu? That's not a rare story. It's actually one of the most common patterns doctors see in women. No crushing chest pain, no collapsing to the floor, just tiredness that won't go away, a strange ache in the jaw, maybe some nausea you blamed on last night's dinner. By the end of this video, you'll know the real list of warning signs, why women's hearts often send different signals than men's, why so many of these signs get brushed off as stress or aging, and exactly what to do if you or someone you love starts noticing them. Stay with me because the third sign on this list is the one most women say they never expected, and it's one of the most commonly reported symptoms in women having a heart attack. I'm not here to scare you today. I'm here to hand you information that could genuinely change how you read your own body from now on. So let's get into it. Before we go further, I want to ask you something. What's one thing about your body that changed after 45 that nobody warned you about? Drop it in the comments. I read every single one, and honestly, a lot of the topics we cover on this channel start right there, in the comments section, with something you told us. Now let's talk about why this topic matters so much. Heart disease is the leading cause of death for women in the United States. Not breast cancer, not any single cancer at all. Heart disease. The American Heart Association has been trying to spread this message for years, and yet surveys keep showing that a large number of women still don't see themselves as at risk. That gap between the actual risk and what women believe about their own risk is exactly why this conversation matters. So let's start with the image most of us grew up with. Picture a man clutching his chest, stumbling, falling to the ground. That's the scene we've all seen in movies and on TV 100 times. It's dramatic, it's fast, and it's memorable. The problem is, that image was built around how heart attacks tend to show up in men. And for a long time, most heart research was done on men too, which meant medicine simply had less information about how women's hearts behave under stress. Here's what researchers have found since then. Women can absolutely experience that classic crushing chest pain. That symptom does happen, and if you ever feel it, you should treat it seriously and get help right away. But research published by the American Heart Association and groups like the Cleveland Clinic has shown that women are more likely than men to have a heart attack with subtle symptoms, or even without obvious chest pain at all. Some studies suggest that close to 2 out of 3 women having a heart attack report little or no chest discomfort. Instead, their bodies use a completely different vocabulary to say something is wrong. Let's walk through that vocabulary together, one sign at a time, because knowing the words your body might use could genuinely save a life. The first sign is unusual fatigue, not the kind of tired you feel after a long day of errands. We're talking about a heavy, unexplained exhaustion that can show up days or, according to some research, even weeks before a heart attack. Women in medical studies have described it as feeling like they were moving through wet cement, or being so drained that walking up a few stairs felt like climbing a mountain. This kind of fatigue often gets brushed off. Many women assume it's just stress, poor sleep, or simply getting older. And to be fair, fatigue can be caused by dozens of harmless things. But when it's new, when it's severe, and when it doesn't improve with rest, that combination is worth paying attention to. The second sign is shortness of breath, sometimes with no chest pain involved at all. Imagine folding laundry, something you've done 1,000 times, and suddenly you're winded like you just ran up a hill. This happens because when the heart isn't pumping efficiently, fluid can build up and make breathing feel harder, even during ordinary movement. Cardiologists often describe this symptom as one of the more commonly under-recognized ones in women because it doesn't scream heart problem the way chest pain does. It just feels like your body is suddenly working harder than it should for simple tasks. But that's not the most surprising part. The third sign is the one that catches almost everyone off guard, including some healthcare providers early in their careers. It's nausea, indigestion, or even vomiting. Picture waking up feeling like you have a stomach bug, maybe some pressure in your upper abdomen, a wave of queasiness that makes you think you just ate something wrong. Research has shown this gastrointestinal type symptom pattern shows up in a meaningful number of women during a heart attack. And it's one of the top reasons heart attacks in women get mistaken for something far less serious, like food poisoning or acid reflux. Let's pause here for a second because I want to ask you something. If you experience sudden nausea along with unusual tiredness on the same day, would you have connected those two things to your heart? Be honest in the comments. Most people say no, and that's exactly the problem this video is trying to fix. Now let's move to the fourth sign, and this one is easy to underestimate because it feels so far from the chest. It's pain in the jaw, neck, back, or one or both arms. This happens because the heart and other areas of the upper body share some of the same nerve pathways, so the brain can misread where the pain signal is actually coming from. Some women describe it as a dull ache between the shoulder blades that won't go away no matter how they shift position. Others describe jaw pain that feels almost like a toothache with no dental cause in sight. Because this pain doesn't sit in the chest, it's often mistaken for a pulled muscle, poor sleeping posture, or even a dental problem. The fifth sign is cold sweats, along with lightheadedness or dizziness. This is your body's stress response kicking in, sometimes described as feeling suddenly clammy, pale, or like you might faint, even though you're just standing in your kitchen doing something completely normal. It's one of the more classic warning signs, but because it can also happen with something as harmless as low blood sugar or dehydration, it often gets explained away in the moment. Here's what makes all 5 of these signs so tricky. On their own, any one of them could be nothing. Fatigue could just mean you need more sleep. Nausea could be last night's dinner. Jaw pain could be your pillow. That's exactly why doctors don't ask you to panic over a single symptom. What matters far more is the pattern. When 2 or 3 of these symptoms show up together, especially if they're new, sudden, or don't match anything you felt before, that combination is what deserves urgent attention. Now here's something that genuinely surprised researchers when they started digging deeper into this. Many women who had heart attacks later described feeling something was wrong for days, sometimes even weeks, before the event itself. In interviews conducted by the American Heart Association's Go Red for Women initiative, women commonly mentioned unusual fatigue and sleep disturbances in the lead-up. This is sometimes referred to in research as prodromal symptoms, meaning early warning signals the body sends before the main event. It doesn't happen for everyone, but it happens often enough that awareness of it could genuinely change outcomes. So why do women so often miss these signs, or delay getting help when they notice them? There are a few honest reasons, and none of them are about women being careless with their health. Quite the opposite, actually. The first reason is what researchers call symptom normalization. Many women are used to pushing through discomfort. Between raising families, working, caring for aging parents, and simply being conditioned to put others first, there's a long-standing pattern of women minimizing their own symptoms. A dull ache gets labeled as just stress. Fatigue gets labeled as just being busy. The second reason is that the symptoms genuinely don't match what we've been taught a heart attack looks like. If you've spent your whole life associating heart attacks with sudden chest-clutching collapse, and what you're feeling is nausea and jaw pain, your brain simply doesn't connect the dots. That's not a personal failure. That's a gap in public health education that researchers and organizations like the American Heart Association have been actively working to close over the past 2 decades. The third reason is delayed care seeking. Multiple studies have found that women, on average, wait longer than men to call for emergency help once symptoms start, and they're also somewhat more likely to be initially misdiagnosed with something like anxiety or acid reflux when they do seek care. This isn't about blame toward patients or doctors. It reflects a medical system that, historically, built its understanding of heart disease around male patients and is still in the process of catching up. Let's shift now from what to watch for to what you can actually do with this information, because knowledge without action isn't very useful. First, get familiar with your own personal risk factors. Some of these you can't change, like age, family history, or having gone through early menopause, which research links to a modestly higher cardiovascular risk. Others are things you have real influence over, like blood pressure, cholesterol levels, blood sugar, smoking status, physical activity, and stress management. Knowing your numbers, your blood pressure, your cholesterol, your fasting blood sugar, gives you and your doctor a much clearer picture than guessing. Second, build a habit of checking in with your body without becoming anxious about it. There's a real difference between health awareness and health anxiety, and the goal here is the first one. You're not trying to diagnose yourself from a video. You're trying to notice when something feels genuinely different from your normal baseline, so you can bring it up with a healthcare professional who can properly evaluate it. Third, and this is important, if you ever experience a combination of these symptoms, especially sudden onset chest discomfort, pressure, or pain, along with any of the other signs we covered, do not wait it out and do not drive yourself. Call emergency services immediately. Every minute matters when it comes to heart muscle, and treatment that arrives faster tends to lead to better outcomes. symptoms. This applies whether you're 45 or 75, and it applies even if a part of you feels embarrassed that it might turn out to be nothing. Emergency room staff would always rather you come in and it be a false alarm than the alternative. Fourth, talk to your doctor honestly, even if a symptom feels minor or embarrassing to describe. Many healthcare providers today are specifically trained to ask about atypical heart attack symptoms in women, partly because of the research we've discussed in this video. You are not wasting anyone's time by mentioning fatigue that feels different or a strange ache you can't explain. Let's bust one more myth before we wrap up, because I think it matters. Some people believe heart disease is mainly an older woman's problem, something to think about after 65 or 70. But research shows cardiovascular risk actually starts climbing earlier than most people expect. And the years around menopause, roughly the mid-40s through mid-50s, tend to be a meaningful turning point. That's largely tied to hormonal shifts, particularly the decline in estrogen, which is believed to have a protective effect on blood vessels earlier in life. This doesn't mean every woman in this age range is at high risk. It simply means this stage of life is a reasonable time to start paying closer attention, rather than waiting until symptoms force the issue. I also want to gently address something. If you've read this list and thought, wait, I've had 2 or 3 of these symptoms recently, please don't panic, and please don't try to self-diagnose from a video, mine or anyone else's. What I genuinely encourage is booking an appointment with your doctor and simply describing what you've been feeling in your own words without downplaying it. That single conversation, more than anything else, is the most useful next step. Before we close out, I'd love to hear from you. Has a doctor, a friend, or your own experience ever surprised you about how differently heart symptoms can show up? Share your story in the comments below. These conversations genuinely help other women reading through them recognize something in their own life they might have brushed off. If you found this helpful and you'd like more videos like this one, breaking down real research in plain, everyday language, without the fear-mongering or the miracle promises, we'd love to have you join us here. We're building this channel one honest conversation at a time, and a lot of what we cover next comes directly from what you tell us in the comments. To wrap up, here's what I hope you walk away with today. Your heart doesn't always speak the way the movies taught us to expect. Sometimes it whispers through tiredness, through a strange ache, through a wave of nausea that seems to come from nowhere. Learning that language isn't about living in fear. It's about giving yourself the same seriousness and attention you so naturally give to everyone else in your life. Take care of yourself. Listen closely when your body speaks, and I'll see you in the next one.